Phones away, notebooks out, ugly kids, bags on, noisy kids, gags in. Let's go. Give me an example of who could not benefit from therapy. And I don't think you could. Maybe you can. Maybe I'm wrong. Maybe I'm entering this conversation with prejudice. I'm suggesting everyone could benefit from therapy. Go ahead. What about the Joker? All right, if we take Batman's Joker, that's actually a really good point, because throughout, I don't know how deep you go into DC Comics, but the Joker is a stone-cold sociopath. He has no empathy whatsoever. And so the question we have is, can you fix him if he has such a personality disorder? If he has such a brain abnormality, or is that just who he is? Batman continually tries to bring him to mental hospital in the Batman world. It's called Arkham Asylum. And he always escapes and he brings him back, and he always escapes and brings him back. Can you force someone to get better who doesn't want to get better? That's what we're going to talk about a few days down the line. A lot of folks look at therapy as kind of last resort. Like, I don't need that. And maybe you don't. Maybe none of us need it. I mean, my metaphor I've used before, I'll use it again. Go ahead and break your ankle. It's a lot of fun. All right? Maybe it's like, if you want extra credit, fine. Come in here on crutches. But let's say this. Let's say you injure yourself. You break your ultriculus. You get your earlobe in a tragic blender accident. However you injure yourself. And you know what? You're really in a lot of pain. You could not go to the doctor. You could tough it out. You go, I don't need that stuff. I'm a thug. And then guess what? You could suffer. You will heal, but you're going to be in pain for a long time. I'm using that same metaphor for mental injury. Now, see, if we use mental illness, that has a connotation, that has a stigma. What if we say mental injury? Something happened to you, you had no control over it. You could suck it up. You could tough it out, just like you could go. It might take you a year to heal a broken ankle with no therapy, no cast, no resetting of the bone, no pain meds. You will get better, but why suffer? That's kind of the way I want to start the class, but that's just if you're injured. What if you're doing fine right now? You're like, I don't need therapy. Okay, I didn't say you did. But let's take a metaphor for, again, one more time, physical. Is there anyone here who cannot be in better shape? Who cannot run faster, be stronger, be more flexible, have a better heartbeat, have a better pulse? If all of us can improve physically, why do we assume we could not improve mentally? Most therapy is designed to heal someone, to get them out of crisis or out of pain. But there is a small but growing part of therapy where instead of we say therapy, we say life coach. Is there anyone here who could be more organized, could be more forgiving of yourself? And so what if we look at that? Give me someone who cannot get better, and I'll show you someone who doesn't need therapy. So what if we start it like that? Treating mental illness, when we talk about therapy, it's a pretty broad topic. There's a lot of ways to do therapy, a lot of types of therapy, a lot of reasons people go to therapy, a lot of ways to do therapy. One of the things, if you're going to be a therapist, if you go to therapy, if you're a patient or a client, and let me put it to you right now, client is the preferred term. Patient, kind of an old-fashioned term. It makes you seem dependent on the doctor. You need them. Client puts the power on you. You can fire your doctor. You can fire your lawyer. You can fire your accountant if you're a client. Client just sounds better. It sounds like it's more voluntary. So if you're a client, why do you want to go? Do you want to find out why you're feeling this way, why you think that way? Do you focus on causes or getting better? What if it's genetic? I mean, if it's genetic, there's not a whole bunch you can do. Do you throw your hands up in the air like, well, no one can help me. There's no environment, there's no evolutionary therapist. Not necessarily. I think therapy is primarily designed to look forward. Take you as you are now and go forward, because I don't think you can really change the past. Maybe you can if you have a time machine. Now, Freud, of course, is going to dip deep into your unconscious, say what happened when, why, what's the root of it. Maybe a lot of modern therapists aren't going to worry too much about what happened back then. Therapy, like I said, it's broad. There's a lot of different things that go on in therapy, but just because it's a dynamic thing, it's a broad chapter, that doesn't mean there aren't common stuff. So what do you have? What do all therapies have? All counseling sessions have? Well, you got to have a client. Without that, you just got someone who's in a lot of debt from student loans, sitting in a wood-paneled office, a lot of books, just waiting for a client to come in. So you need a client. Now, do you need a therapist? That's some debate in there. There's a really bad psychology joke. I went into Barnes & Noble. I studied psychology. I want to get some of the latest books. And I went to some, the checkout person behind the counter. Excuse me, where's the self-help section? And that person said, I can't tell you. And it took me a while to get it, just like it's going to take you a while to get that joke. It's not funny. But the idea is, do you need a therapist? Do you need someone to tell you what's wrong with you, or do you know what's wrong with you? How many of y'all are still working on the punchline of that joke? Do you need a therapist? Here's an interesting concept. I suggest that 99.9% of all therapists want to help. Yeah, if you find some of the obscure literature or novels or Hollywood movies, there might be like one nefarious psychiatrist that takes a client and messes with a client. If you looked at like Dr. Hannibal Lecter, who uses whatever insight he has into the human mind and suffering and manipulates people. We can always find the rare cases of a psychiatrist or psychotherapist who implants a false memory, something about abuse, where the woman thought that her dad had abused her, but he hadn't, and it destroys lives. Is that possible? Yeah. But most therapists, just like most teachers, except for me, most cops, most doctors, most professionals, are pretty good people. They're there for the right reasons. Even said that, what if they misunderstand the right reasons? Here's a fringe idea. I say it's fringe, I disagree with it, but I'm going to throw it out to you. Some folks are going to say that therapy is designed to keep people in line. So anytime you have someone that deviates from the norm, psychiatry says they're sick. They're ill. Let's medicate them back into conformity. Someone has a new idea, someone thinks differently, they're a little bit weird, we might call them ill. Let's pummel them back with chemical hammers, label them ill, and try to control them that way. I don't agree with it. Maybe, just maybe, our society is afraid of weirdness and newness, and we call that crazy. But if you look, gentleman's name's Thomas Szasz, and he's one of the proponents that says psychiatry, by its very nature, the industry, the sub-discipline of medicine or psychology, is used to impose social norms. I don't agree with it. I think people are suffering, and I think therapy does a great job. Let's talk about the relationship. Psychotherapy, counseling, needs a relationship between the professional and the client. It's not that therapy's done to you. It's dynamic. It's both ways. You need to reach out. If you're the client, you need to try. Therapy's sometimes very, very hard. It's a lot of work. Now let's look at this. I wrote it can be legally protected. I'm going to go so far as not only can it be legally protected, it is. Not only can it be legally, not only should it be legally protected, it is. If you're a lawyer, and your lawyer says, all right, tell me everything, leave nothing out. If I'm going to defend you, I got to know all the facts, and whatever you tell me is protected by attorney-client privilege. That same relationship extends to a therapist. If you tell your deepest, darkest secrets, what you have done, what's been done to you, what you want to do, your therapist will not tell anyone. Not only will they not, they cannot. Their licensure depends on it. Their ethical code depends on it. And even if it goes so bad, let's say they sell you out. Let's say they write a book about all the juicy stuff over years their clients have ever said in therapy, and they name you, and they tell you what they tell the book all the juicy secrets. You can sue them. They must protect you. However, go ahead, please.
Can they say it without naming you?
They have to be extremely careful. Yes, they can. Their number one goal is to protect the fiduciary, that means faithful or confidentiality, fiduciary responsibility to their client. That's their number one goal. Secondary is to make money. So you can see it puts a professional in a tough situation. If they're going out of business, what's their number one job? To pay their bills and their mortgage, or to take care of their clients? Now, just because the relationship can be protected doesn't mean that, of course, you know psychology. You know, of course, that there's always going to be an exception. Let's look at the Tarasoff rule. Tarasoff rule simply means this. If a client goes to a therapist and says, God, I'm so mad at my boss, I'm going to kill him. I could just, that's nothing. We all get mad at that. Family member, wife, husband, mother, father, kids, whatever. But if you say, I'm so mad at my boss, after this session, I'm going to go kill him. Here's my gun. Here's how I'm going to do it. The therapist's like, whoa. Then they must alert the authorities. Now, there's a gray area. How can you predict what someone else is going to do? Because if you predict falsely and say, oh my gosh, my client's going to go kill someone, and the client never was, then you totally betrayed their confidentiality. But if you say they probably won't hurt anyone, I better not betray their confidentiality, but they do end up hurting someone, well then number one, you allowed that to happen. Number two, you're not a very good therapist. You might be brought up on charges. So the Tarasoff rule is a gray area. The idea is to protect people If a client or patient says, I'm going to go harm this person, the professional has a legal responsibility to go prevent that. Questions on that? Let's look a little bit more at the relationship. When we talk about the relationship of a therapist and a client, that's probably the most important thing. It almost doesn't matter what type of therapy. It almost doesn't matter what techniques are used. The most important thing is that there is a personal connection, a true relationship. Both people have to care. Both people have to try. Remember, therapy can't be done to you. You've got to want it. And I'm not saying that all therapists mesh well with all clients. Maybe it could be the case where you shop for a therapist and you don't click. Personality-wise, background-wise, sense of humor-wise, it just doesn't mesh. And maybe you got to find a good match, because the match, the personality, the relationship, that's one of the biggest predictors of therapeutic success. Number 4, you got to have a theory, kind of a guiding principle. What are you going to do, or how are you going to frame what you're going to do? What I mean by this, go back to our 7 paradigms. Is the person in front of you, if you're a therapist, is your client suffering because of childhood abuse? Is your client suffering because they're thinking the wrong thoughts? That's the cognitive one. How about behavioral? They're doing the wrong behaviors. How about chemical? You know why they're suffering? Because their brain has not enough serotonin. And then number 5, procedures are specifically what you're going to do. If you believe in the bio paradigm, then you're going to recommend they take medicine. If you believe in the psychodynamic paradigm, we're going to start trying to figure out what's going on unconsciously. Some people don't want therapy. Why don't they want therapy? There's a couple reasons. I think the first one, I could read all these big words, just write down stigma. I got a fair amount of students who have gone, who are going to therapy right now. And whenever their parents or counselor, they email me, please don't tell anyone. Very, very confidential. And I think that says it all. If you go to therapy, a lot of people are shy about it, and that's fine. Our society still has barriers to this. So I think the first one's going to be stigma. The second one might be that people might not realize. Now, I want to use these words carefully. I'm not going to say people don't realize they need therapy. What if I said people don't realize they can benefit? Because everyone can benefit. Even therapists go to therapy. Accountants have accountants. So therapists and psychologists and psychiatrists, they do go to therapy. I think there are barriers to treatment, and let's look specifically at the barriers for treatment. The first barrier is that people may not know where to look for a therapist. What are you going to do if you think you need therapy? Google? Do you go to Yelp? Yellow Pages? Do you ask your friend? Do you ask your primary care physician? Now, your primary care physician might write you a referral. But who is your primary care physician going to refer? Someone in your insurance network, the best person for you? I think people do more research on what phone to get than on what therapist to use. That's a wild thing. I mean, if you Google right now, therapists in our county, you're going to get a rack load of them. This is a pretty educated area. You can't swing a dead cat without hitting a PhD somewhere. I don't know what that meant. But it's not right. Why would I even say that? But if you live in like some rural Pennsylvania somewhere, all right, where people, like a whole family shares teeth, they got summer teeth, some in their mouth, some in their pocket, right?
Ew.
I didn't say it was good. No one wants to live in Pennsylvania, but whatever. Let's say you live in a small town, and you got one therapist, or maybe you don't have any therapist. Is that therapist going to be the best for you? And you can see I approach that with ridiculous Pennsylvania jokes, but in small town America, there aren't a lot of physicians. In big cities, there are a lot of physicians. Small town America, not so much. What if that therapist isn't for you? Or more specifically, what if that therapist everyone goes to? Everyone in the town goes to that therapist, and you happen to be the auto mechanic of that small town. The therapist brings his car to you, you go to him. We're going to talk about conflicts in relationships. You probably don't want to have that, because if you don't like your therapist, what are you going to do, not fix their car? If someone doesn't fix your car and you're the therapist, what are you going to do, not heal them? We got there's a whole bunch of dynamics when we get into ethics of that, but it's a little bit further ahead. When people do seek help, sometimes they don't get the most effective treatments. Therapy is kind of weird. It's unlike other medical specialties. If you go to a physician for a broken ankle, the physician is going to give you what you need. Okay. If you go to a therapist, oftentimes the therapist is going to give you what the therapist was trained in. Therapists are often trained in a few paradigms and a few techniques, and that might be not what you need. So who determines what you get? What the therapist was trained in, which is kind of why you might want to shop around. Again, people shop around for a phone, a prom dress, a car, but they don't necessarily shop around for therapy because sometimes the therapist gives you what the therapist wants to give you because that's the only way they know how to give it. Go ahead.
How do you know what you want?
That's a really good question. If you really think about it, not to some people just, almost any therapy will work. They need counseling, they need to work through something minor and temporary. Okay, for that, I think almost any therapist will work. But if you were to research someone, you want to find out what their specialty is, what content, whether it's eating disorder, depression, addiction, and you want to figure out how do they go about treating it. Is it medicinally with prescriptions? Is it group therapy? How do they think? And you're right, for the layman, which is people who don't have their background in psychology, it could be confusing. How do you know you're getting the therapist for you? And some people are like, I just need treatment now. I don't have time to shop around. It's a great question. I don't have any easy answers. I think there's two general categories of therapy. Two general categories of therapy. The first one is going to be out. I don't know offhand what percentage of people who receive mental health treatment are outpatient versus inpatient. Vast majority are outpatient. You know what that means? That means they drive to the therapist's office. Whether that office is right next to a hospital or in some professional center somewhere, or maybe some therapists, they actually have a home office. You drive to their house, like some dentists do that, some accountants do that. So you drive there, usually once a week, maybe twice a week for an hour, although we'll discuss a little bit later why you pay for an hour, but you only get 50 minutes of talk time. They're like, that's not fair, that's cheating. We'll talk about that a little bit later. Outpatient clients tend to be younger, tend to be female, middle or upper class. Well, middle or upper classes, that's pretty easy because those might be the folks with better health insurance, with more disposable income. Also, maybe, just maybe, there's a cultural component that folks in the middle or upper classes are slightly more educated and might be slightly more tolerant of therapy, whereas folks in the lower end of our society might look at that with a little more suspicion. Go ahead.
So do you think that not a lot of people that need therapy don't get it because some like lower socioeconomic families see it as more of a luxury than...
Could be. That's a luxury might be a good word. You don't need that. Everyone's got problems. Tough it up. Suck it out. Get the idea. Female. Does that mean that women need more therapy? They get sicker or have more issues? Or women just seek therapy out more often? And men will just sit there and like grin and bear it and tough it out and get a 30-pack of Bud Light and get drunk. All right, tend to be younger. I want you to go ask your nana, go ask your pop, and we talked about embarrassing names for your grandparents. Ask them what they think about therapy. Pop, have you ever thought of going to see a psychologist? No, I ain't going to a head shrinker. The other group of people who receive treatment are inpatient. Much more rare. Much more rare for them to be inpatient versus outpatient. Can anyone tell me why? Why do you think it would be much more rare to be an inpatient versus outpatient? All right, so instead of having this awkward silence, let me prompt you with this. If you've ever spent a night or two in the hospital for whatever, you got an infected hair follicle or something like that, I don't know, you lost your eyebrows in a tragic blender accident. My point to you is this. Have you ever looked at the medical bill for how much it costs to stay one night in hospital? Thousands of dollars. So you can see that a doctor might be very hesitant to say, we're going to admit you for a night. Most of the time, doctors, if you've ever had surgery, very often it's done in the morning. They keep you for a couple hours and they send you home in the afternoon. Has anyone ever had that happen to you? That's pretty common because they don't want to keep you overnight. Maybe because insurance companies don't want to pay for it. Insurance companies keep track of which doctors admit how many people overnight. So sometimes doctors might be a little hesitant. It's a whole other can of worms, the politics of insurance companies versus what's best for patients. One of the criteria, it's very hard to be admitted into a hospital. One of the criteria a doctor's going to use is the client, is the person a possible danger to self and others? If this threshold is not met, then you know what, maybe you should just see me tomorrow during office hours. You can imagine someone brought into an emergency room, and for whatever reason, maybe it's the police, maybe it's the ambulance, maybe a loved one brings them in, they're really struggling. And the doctor looks at the person and says, you know what, are you going to hurt yourself? Do you feel like hurting anyone else? And the person's like, no, I'm just, doctor. And their mind might be like, all right, well, I'll see you tomorrow in my office. Why? Maybe it costs too much. Of the people who receive therapy, let's just throw out the number, 99% are outpatient. Of the 1% that are inpatient, 99% are voluntary. People want to go to the hospital to get better. It is extremely rare to be an involuntary patient in a psychiatric ward in the hospital. Extremely rare. Why? What's that?
An asylum?
An asylum's kind of an old-fashioned word. We don't have too many mental hospitals left. There really are not many across the country. And we're going to get into that. There are a few. My point to you is why? Why do you think it is so hard to put someone in a hospital for 1 day, 2 days, 3 days, 4 days, or longer if they don't want it? Clearly they need it. Everyone in the world says they need it, but they don't want to be in a hospital. So why can't we just lock them up? They might hurt themselves. They're a possible danger. Here's why. You can't lock someone up for a crime they might commit. We have this thing called a constitution. It's not against the law to be ill. And if someone doesn't want to be there, you cannot force medicine down their throat. Even if they might harm someone. They might. We all might harm someone. And that really, you can see there's a tough situation. Someone doesn't want therapy, but they need it. You can't force it to them. Who gives therapy? A couple rough categories, broad categories. They overlap quite a bit. Psychiatrists, and I kind of put them in descending order of, I guess, prestige, maybe average salary. Psychiatrists are probably at the top of the pyramid, although as soon as I see that, I have a bunch of colleagues that would yell at me. They say, how dare you say that? We've worked just as hard. Because the colleagues I'm talking about are PhDs. On top of the pyramid, MD, Doctor of Medicine. Why do you care about this? 2 facts. They went to med school, so they have a really strong foundation of biology and metabolic processes. And number 2, they're the only ones that can prescribe medicine. They're the only ones that can prescribe medicine. So you can see that psychiatrists might be a little bit, on average, a little bit more biased towards the biological paradigm. Because they're going to think, every single issue is really an issue with the brain. In the extreme, a psychiatrist who might be so biological says there's no such thing as mental illness. It's all physical illness. But instead of the pancreas, we're talking with a different organ. It's called the brain. And all the talk therapy is great, but at the end of the day, talk therapy is not going to help until the brain gets healthy. Psychologists. Now, I'm not saying psychologists are less effective, but generally in society, some people think medical doctors are on a pedestal. PhDs, some people think that's pretty good stuff, but not as good as a medical doctor. Technically, a PhD is a doctor of philosophy. When you see a PhD, it's generally someone who's proven themselves to be able to do research, be familiar and fluent in research, and you want that. You want your doctor to be up on the absolute latest techniques, what has been proven to work and proven not to work. There's also, if you have a doctor of psychology, a doctor of psychology instead of a doctor of philosophy. That designation would be a PsyD versus a PhD. There's a big debate in every state capital. Now, some states do allow psychologists to prescribe some drugs in certain conditions. I mean, not all, I don't know what each state rule is, and not all doctors should be able to prescribe all medicines outside of their medical specialty. But some medical doctors are saying psychologists shouldn't have the right to prescribe medicine. And some psychologists are saying, how dare you say we're not as educated as you? I've taken just as many courses. I'm a leading expert in neurochemistry. Don't tell me I shouldn't have the right to prescribe medicine. Are they really arguing academically, or are they really trying to protect a monopoly on who can provide services? Is it come down to financial and legal rights? Probably. I'm very sure there are a lot of psychologists who have every bit of learning, every bit of biological expertise to prescribe medicine. The next level down might be general counselors, licensed clinical social workers, therapists, family therapists, marriage counselors. Now, again, roughly, you need a lot of schooling to be any one of these. This is not something you get your associate's degree, your bachelor's degree, and you leave like, all right, I'm ready. Not only do you need a lot of academic work, but you need to go through extra work to prove and to get what's called state licensure. So I don't mean to in any way, shape, or form denigrate these by putting these in a hierarchy. There are some licensed social workers who probably have more education and more expertise than medical doctors or PhDs. School counselors I don't think any of our school counselors have a license to practice mental health in the state of Maryland. They have some ability within the confines of being a school counselor, but if you have a problem, if it's a pretty severe problem, the counselor will do their best to say, this is so far outside of my expertise. I know a little bit about it. I suggest a counselor knows a little bit about a lot, but once a student goes to them and starts really, the counselor's going to refer them. And I mean, even if you did have a teacher who knew a lot about this stuff in psychology, you got a teacher who could teach about this stuff and maybe could actually offer therapy. I've had a fair amount of people who come and pour their heart out to me, who are students and who are friends. And I got to say, I can't help them. Even if I could, I can't. Because if you have a relationship with someone as a teacher or a friend, then you can't really have the same relationship with them as a therapist. If you want a really good job that deals with mental health, and let's face it, mental health is fascinating. It's some good stuff, but maybe, just maybe, you don't want to jump through all of the educational hoops. You don't want to put yourself thousands and thousands of dollars in debt. I think this wouldn't be too far off, but if you graduate from med school, it's a pretty good bet. You're about $200,000 in debt. Wow. Maybe you really do love this stuff. You want to help people, you find it fascinating, but you don't want to put yourself at that much of a financial risk. I think psychiatric nurses is a great way to go. We have a shortage of nurses, so it's a great career move anyway. You get to be involved in all of the fascinating mental health stuff. The advantage is you're going to have a secure job and you get to work in what you love. The disadvantage, you might not make as much money, but guess what? If your name isn't the one, if you're kind of working under a doctor, if ever the doctor gets sued, you're fine. Very few people ever sue a nurse. A lot of people sue a doctor.
Wait, so they like to do that work out mental hospitals?
Oh yeah, if you're a psychiatric nurse, you work in a hospital. I mean, every hospital has different areas, different wards or floors. You have the pediatric ward, the orthopedic ward, the cardiac ward. You're going to have the psychiatric ward. And so there are cardiac nurses, there are pediatric nurses, there's going to be psychiatric nurses. So if you love this stuff and you want to work with people, but you don't want to either put yourself in debt or spend the next 10 years of your life in school, psychiatric nurse is a pretty good option.
Could switching to Geico really save you 15% or more on car insurance? Does a former drill sergeant make a terrible therapist?
And that's why yellow makes me sad, I think.
That's interesting. You know what makes me sad?
You do! Maybe we should chug on over to Mamby-Pamby land, where maybe we can find some self-confidence for you, you jackwagon!
Tissue? Cry, baby.
Geico. 15 minutes could save you 15% or more.
You know, no one's ever helped me. Me against the world. So put your phones away. Ain't no one texting you back, young lady.